All right, welcome back to Fire Talks. My name is Chris Brunette, your host as always. I am the Chief of the Fire and Life Safety Section with the Colorado Division of Fire Prevention and Control, and I'm happy to bring this episode to you. Today I am joined by some of the leadership from our Fire Prevention Branch. Our Fire Prevention Branch is responsible for enforcement of fire and life safety codes in our licensed healthcare facilities, as well as the fire codes in our public schools, charter schools, and junior colleges. They take care of our casinos as well as our waste tire facilities, and also help out with fireworks when 4th of July comes around. So today we're going to be focusing on that healthcare element of what they do. And so joining us is Jay Wilmot. He's the branch chief for the Fire and Prevention Branch. Brian Adams is one of our inspection unit chiefs. And so is Pete Anderson. So they each have a specific area within healthcare facilities that they attend to, and I'll let them explain that a little bit more. But to kick us off, Jay, do you want to introduce yourself a little bit more?
Yeah, absolutely. Thanks, Chris. My name is Jay Wilmot. I'm the branch chief of the Fire Prevention Branch here at DFPC. And today we're focusing on the healthcare aspects of what we take care of. And healthcare in Colorado is a pretty broad subject, so we've broken it up into two units. Residential and acute, which Brian and Pete both represent. So I'll turn it over to them to kind of get an overview of their program. Brian, we'll start with you.
Yeah, thank you, Jay. My name is Brian Adams. I'm the inspection unit chief with the Fire Prevention Branch. I am in charge of the residential side, which is in charge of ALRs, nursing homes, and ESRDs through the state. So, yeah, basically we do life safety inspections on that behalf on nursing homes, ALRs, private pay and certified ALRs, and ESRDs. So Pete, do you want to introduce yourself?
Yes, thank you. I am Pete Anderson. I'm the acute healthcare unit chief. So my program covers hospitals, ambulatory surgical centers, and also behavioral health entities for the Behavioral Health Administration. We work really close in conjunction with Colorado Department of Public Health and also the Behavioral Health Administration to get all these inspections and surveys completed.
Very good. You brought up an important point there, Pete. We do partner with other state agencies, the big ones being the Colorado Department of Public Health and Environment, but also the Behavioral Health Administration. They both have a lot to do with these healthcare facilities, and it's in partnership with them that we make sure that anybody who's entering those facilities are well taken care of, especially from the fire and life safety standpoint. You guys want to tell us a little bit about that?
Sure. Yeah, like Chris said, we do partner with CDPHE on that behalf. In 2013, before then, we were kind of tied in with CDPHE on the life safety side, and then House bill passed through legislation. And in 2013, July 1st, 2013, we broke off and we became the Division of Fire Prevention Control on the fire prevention side. And so we broke off into our life safety team, which we controlled the healthcare side. In 2013 to, what was that, 2023, there was one unit chief that was in charge of all healthcare, meaning that they were in charge of all the hospitals, nursing homes, and everything else. So that was definitely overwhelming, especially with the workload coming up and the workload that we had. And I'll let Pete touch base when we took over BHAs. But as soon as we took over BHAs, we reevaluated and really wanted to split up into two different unit chiefs to make sure that we were focusing on all the programs that we were in charge of and putting the leadership towards them that needed to be. So with CDPHE, we work closely hand in hand with them. We do tons of meetings. We meet with them. We do provide certificate compliance, meaning that's a COC, meaning that all the facilities meet all the life safety criteria on the code set that we use, which is the Life Safety Code 101 2012 edition. And we provide that to CDPHE, and that continues your license through all the healthcare programs through the state. And BHA is involved in that too, and I'll let Pete touch base on that too.
Yeah, with the Behavioral Health Administration, it kind of came around in 2024. It kind of came to fruition. They started at it. It'd been a couple of years before they tried to start that. It took them a little while, and since January 1st of 2024, we took over purview of all over the behavioral health entities in the state of Colorado. And so we partner really close with Behavioral Health Administration to make sure we issue the certificate of compliances and any new facilities that are come in. And it really is on the behavioral health side of things, there's a lot of growth in Colorado. So we have a lot of facilities coming in, and trying to work with Behavioral Health Administration is very key for us. Also on the hospital side, not only do we work with CDPHE, we also work with Centers for Medicare and Medicaid Services, because a lot of our hospitals in the state are what we call deemed facilities. They have other regulatory agencies that they kind of manage them on a yearly basis or every 3 years. And so we work with both CDPHE and CMS on completing those surveys. When we go do a hospital, it can take anywhere from a week to 2 weeks, if not longer. And then a behavioral health usually is smaller facilities, and it usually takes us a couple hours or a day to complete those surveys.
Yeah, so as you guys have outlined, we've had responsibilities within the healthcare facilities, especially those licensed by CDPHE, for quite a while now. But you mentioned, Pete, that the behavioral health entities that are now under the authority of the Behavioral Health Administration have come under our responsibilities, our area of responsibility. And so that's kind of been a learning curve for us. There are some new facility types within the Behavioral Health Administration that we've had to try to learn to work with, including telehealth and digital health. And so we've been navigating that. Some of our listeners might have questions about how we're navigating that. Do you want to share with them what we're doing with those types of facilities in particular?
Yes, Chris. Because we work so close with Behavioral Health Administration, they'll let us know, and the facility will let us know that if it's a telehealth or digital only. And so what happens is, if it's telehealth, they don't have a building. They might just have in their house or home that they're actually doing I forgot the word, seeing patients or people that they're trying to help. And so what we do is we just issue a certificate of compliance. I'm sorry, I'll back up, not a certificate of compliance. We issue what we call a telehealth letter, because they don't have a structure that we can go and inspect. So we just issue that telehealth letter for them to make it easier for them to start operating right away. We also have been having some behavioral health entities that are trying to get into a building, either leasing or renting a space, because it takes a little while for us to get the plan reviews done. We've been working with BHA to get a telehealth only letter to them also, so they can at least operate and start seeing some patients and helping the community out. So we issue that telehealth letter only until we can get the plan review on these spaces completed and the inspection completed.
That makes a lot of sense. I mean, if there's not a physical location where patients are going to, and where we need to be worried about fire and life safety for those patients, it doesn't make sense for us to be doing any type of inspections or plan reviews. So I'm glad that we've accommodated those, but it sounds like we've taken that accommodation a little bit further, where for those areas or facilities that haven't been fully approved yet, we're giving them that opportunity to provide those telehealth or virtual services to begin with, so that at least we're getting that benefit out to the community until we can get the facility open. So sounds like you guys are being accommodating and working through a lot of the challenges of bringing on all these new facilities. Remind me, I think it was around 900 new facilities that are coming in under this program. Is that right, Pete?
Initially, we had about 900 facilities, and I believe we're up to, I want to say, around 1,200 facilities, and we have more coming in. Our plan review queue, probably about 50% of our plan review queue are behavioral health facilities. So it's definitely growing quite a bit, and we keep on having more and more facilities come in for plan review. And so we try to work with Behavioral Health Administration to make sure that that's kind of a flawless process. But it's because it's our process with BHA is a little bit newer. There's definitely been some hiccups, and we're trying to kind of work through those issues. And there's a lot of communication. I communicate with Behavioral Health Administration. I have a contact with them that I communicate pretty much on a regular basis, on a daily basis, to try to make sure that we get all of our information and the correct information to push the behavioral health entities through and get inspections done, plan reviews done, things like that.
Sounds like an awful lot of work. So we've added all those facilities to our responsibility. But before that, even with just the licensed healthcare facilities, I believe we were responsible for about 2,400 facilities. And that's just on the healthcare side of things. And that's not even to mention all the schools and charter schools that we're responsible for, as well as casinos and waste tire facilities. It's a lot to try and manage. And of course, there's a lot that goes into not only plan reviews, but inspections. And that takes quite a bit of capacity. Jay, do you want to talk to what we have here within the fire prevention branch as far as capacity and individuals who are working on all of these different responsibilities that we're trying to provide?
Yeah, absolutely. Beyond these two units, we have two other units. We have our plan review unit, which Pete had touched on a little bit, which is composed of another unit chief, Mike Garantano, and 5 plans examiners. So they're the ones that get a little bit more into the engineering, looking at the building plans, looking at the specs of systems. We break it down as far as passive and active fire protections in a building. Passive being what's the building itself made of, and active being fire alarm, fire sprinklers, suppression, things like that are incorporated into a building to make it safer. And then our other unit, we lovingly call it the scraps unit, but it's composed of a lot of different programs. That's where school program lies, suppression, fireworks, waste tire, and but all of our inspectors should be trained to cover the broad spectrum of the different types of inspections that we conduct on a weekly basis. Pete and Brian, we touched on it a little bit earlier, but I'd like to expand for some of our listeners that might be outside of the section or maybe the division. And that's our license frequency. We're licensed, not all the same. It depends on the facility type, on a 1 year, 3 year, 5 year cycle. Can you guys expand a little bit about the different types of facilities, what the licensing frequency is, and how often those people that work in those facilities can expect to see our trucks out front?
Yeah, I'll touch base on that first. And I want to bring up a good point too. Not only we picked up BHAs, but July 1st of 2021, legislation passed a bill too that we took over licensed facilities, meaning private paid facilities. Back in 2013, when we first came out, we only did certified facilities, meaning that they only received government funding, Medicaid or Medicare, and that was included on the ALRs. But in 2021, we took preview of all those ALR private pays, which put a significant amount of workload on us. Before 2021, they fell into the jurisdiction only with the local fire departments, and we accepted their fire inspection reports, and then we issued our COC through CDPHE still. But as of right now, 2021, we picked those up, and so we're trying to catch up on those and make sure we're hitting those facilities. And that roughly gave us an extra 900 to 1,200 facilities throughout the state that we were covering. To answer your question, Jay, for nursing homes or long-term care, we do a CMS inspection we're contract through the federal government. We are the state agency through the federal government, and we do them on a yearly basis. And what happens with that is the health department comes in and does a health inspection, and then about 10 days to 30 days, we come back in and make sure that we do a life safety inspection with the long-term care. And that's on a yearly basis. COVID kind of put us back a little bit on that because of COVID. We kind of slowed down on that and weren't doing as many inspections. So there's facilities out there that we haven't seen in a year and a half or 2 years. But as of right now, I talked to our liaison with CDPHE and we're getting pretty much caught up on that. So we will be consistently being in on the long-term care or nursing home SNFs on a yearly basis. When it comes to ALRs and our licensure and certification, the COC is good for 3 years. So meaning that you should only get a life safety inspection every 3 years on the ALR basis. With that being said, there is a COC fee that is associated with that. We break it down by year, and that is broken down for every year we send out an invoice for $500. The total COC invoice cost is $1,500, but when we made our rules, we thought it would be good for the smaller facilities if we broke it down by years. And it was easier for them financially to pay $500 every year, up to $1,500 for 3 years. So you should expect that you can renew your license with CDPHE up to 3 years with the current COC that you have. If there is not a current COC on file with CDPHE, that will require to make sure that you guys, our fees are caught up and make sure the COC fees, and then that will require an inspection. With that being said, we do understand that COVID put us behind the 8 ball with that a little bit. So we have been issuing COCs on facilities that we haven't been in, on the hopes that we get caught up in our inspections. So not necessarily if you don't have an inspection, that doesn't mean we can't issue a temporary COC or a provisional COC so you can renew your license and then we'll be back in your facility. And I think that's about it on my end. Pete, did you want to talk about hospitals?
Yeah, hospitals, because of the type of nature that they are, kind of acute healthcare, we issue a COC every 5 years for them. We will come in and do an inspection about every 5 years. Kind of the same thing with COVID. We were kind of behind on some of the hospitals in Colorado, and so we're trying to catch up on them. On the hospital side, we could also end up doing either a complaint survey or a CMS survey if they are deemed or not deemed. If they're not a not deemed facility, we'll actually be in there just like a nursing home. We could be in there every 12 to 18 months. But if it's a deemed hospital, it's every 5 years unless we get a complaint survey, and then we might have to come in there a little bit sooner than that. Behavioral health facilities, we set it up for every 3 years right now. We're trying to work through some of our rule changes and things like that we might be able or changing that for some of the facilities, because we do have a lot of small facilities that are just one office or whatever. So we're kind of trying to look at some things on making that a little bit easier for those facilities and for us. On the ambulatory surgical centers that we have, it's kind of the same thing with the hospital. We might go in there only every 3 years, but you also might have a CMS survey that we are in there more frequent, that would come out for us. CMS tells us when we have to go into those facilities. So we don't know exactly when we will be in them unless CMS tells us.
Right.
Um,
To that point, Pete and Brian, a question I get a lot, and let's pretend, I'm not the branch chief of the branch for a minute. Question that I get almost every week, and I think our listeners might be asking themselves this as well. What is the expectation for the facilities as far as notifying us if they think it's time for their COC inspection? Is there a duty for them to notify us, or how does that process work? And obviously, I know the answer, but let's touch on that a little bit for our listeners that might be outside of the fire service. Brian, I'll start with you.
Yeah, we do have a COC request form on our website. If you reach out to CDPHE and they said, "Hey, we need a COC from Life Safety," if you go to our website, which is divisionfirepreventioncontrol.com, and go on our website and go through fire prevention side, fire life safety, fire prevention, and healthcare. And there's a form on there that will let you request a COC. And the way that happens is we get an email with your facility name, your address, your ID. And what we do is look it up and make sure you either don't have a current COC, if your invoices have been paid, or the latest inspection. And we're looking at too is if you have an open permit. The possibility of you not getting a COC is you opened a permit to do your fire alarm, and we never came out and did inspections, but we have an open permit, and we look at that, and you'll get an email from us saying, "Hey, you have an open permit. We never got any inspections done with this. We need to follow up on this before we can issue a COC." And we try to do that consistently. There's a lot of people that reach out to us through the website, and I try to reach out and to deal with those COCs on a weekly basis. Sometimes it could be 2 weeks before we can reach out, but you will either hear an email from one of us, or we'll contact you through phone if there's an issue with invoice balances and or an inspection that had deficiencies that need to be corrected before we can issue or an open permit. On the CMS side, when it comes to that side of things, basically we're in there yearly, so we should be once your corrections are made, we should be issuing a new COC every year, which we never really get tied up with that because our COCs are good for 3 years, so theoretically we should be issuing a COC. So I don't deal with much on the nursing home side of things for COC requests, but ALRs are definitely those type of requests. Go ahead, Pete.
So it's the same thing kind of for the nursing homes and ALRs. If a hospital needs to get a certificate of compliance, they can go onto our website and request a COC. Usually, we try to work with CDPHE on that. Also, they'll usually let us know that their license is expiring, and so they'll communicate with us that, hey, we need a current COC. So we kind of work with both. You can go to our website to do that, and sometimes we're notified by CDPHE. On the behavior health side, because it's such a new program, most of our behavior health entities that are out there already have a current COC, other than the new facilities that are coming in for plan review. So we haven't seen a huge influx in COC requests from the behavior health side. Sometimes what they'll do is a facility will request a COC through a website, but they haven't gotten the plan review done, and it's just because these entities, because they're newer and they're newer to us, they don't know how we operate as well, and so a lot of these facilities also will contact Behavior Health Administration to figure out who to contact, and usually they'll contact myself or Jay. They'll contact you, I know, and then you forward those emails on to me. So there's a couple of different ways of getting those requests in, and we try to accommodate them as quick as we can when they come in. We don't want a facility to lose their license we want them to continue operating. So we try to expedite those as quick as possible.
And I got another point to bring up too, Jay.
Yeah.
We do have a monthly rotation of COCs that need to be done on a monthly basis. We do have a system that shows us that, hey, this CLC is expiring in the next 6 months. They come on a monthly rotation, and we're trying to get our inspectors out to do an inspection. So that gives you guys time to make sure that your deficiencies are corrected and it doesn't hold up on your license. Obviously, with COVID, it kind of put us behind on that, but we are, I think, currently really close to being caught up and being on that same track of the monthly basis coming out and seeing the ALRs a little bit more.
No, absolutely. Our team has done a really good job lately of reeling in those numbers and getting caught up, which can be difficult. Brian, Pete, to that point, and you kind of set me up for this, Brian, let's talk a little bit about the inspection process itself. Let's say I've requested my COC or I'm up for a re-inspection. I look out front and I see the DFPC trucks pulling up out front of my facility. What does the inspection process look like, and what does it look like after we leave? You touched a little bit on plan of correction. What does that look like for a facility? What can they expect?
Okay, so every facility is a little bit different, but first of all, I just want to make this clear. We're not, it seems like we try to, people get really nervous. Oh my gosh, the state's here and we're going to freak out and all that kind of stuff. We're not there to freak you guys out. We all have one goal in mind, is make sure that staff and residents are the safety of everybody in that building. And just like our, customers out there and our stakeholders is, you guys have that same thought in our mind. So basically, yes, we're there to do an inspection or a survey, but we're there to teach too. And we want to make sure we push that across, because the better we teach to you guys, the better the facility is going to be. And then it just makes our job a lot easier in the long run. So with that being said, if we show up, don't freak out. It's not the end of the world. We will work with you guys as much as we can. When it comes to SNFs and long-term care, we obviously have to follow the rules of CMS, which is the federal government, and we follow their guidelines. And we have a SOM, it's called the State Operation Manual, and we follow through all those steps of that. So there's tight deadlines through that. So when we do our inspection with that, we basically write K tags, and then we file 2786 through CDPHE and the federal government, and everything gets approved. And then the POC is due within 10 days of us, or I'm sorry, let me back up a little bit. We have 10 days to write the report. And then you guys have 10 days after the report is written to come up with the POC and submit through Coffee, which is a portal through CDPHE. A lot of people know that term. And we accept the POC, and then you have basically 90 days to fix your corrections on the CMS side of things. We like to see that the corrections are done within 60 days, because 90 days is pushing your termination track, meaning that you will lose funding for CMS through the federal government if you do not get those corrected. So on day 60, that's where we're trying to make sure that we are getting those corrections completed. And the way that happens is you file your corrections through either a desk revisit or an on-site revisit. The desk revisits is you file your corrections through CDPHE. We get a revisit packet and we look through there and make sure everything's corrected on that side of things. If we do a on-site revisit, that means that we come out and make sure that physically come out and do a re-inspection and make sure those corrections are been made. On the ALR side, when it comes to certified and licensure facilities, there's a little bit more wiggle room. Still, the timelines are still the same. We expect that the corrections be made in 90 days, but we have a little bit more wiggle room when we come out there and do those inspections. Also, I want to bring up too, back up a little bit, on the CMS side with nursing homes, there's a process called a waiver you can apply for, meaning that if the correction is going to take longer than 90 days, the suggestion is that you apply for a waiver, and that's a document that gives you an opportunity to say you have to do the corrections. It won't be corrected until 6 months down the road. We approve the waiver, and you have 6 months to correct that. And then that takes you off the termination track and everything else, and you can move forward as a facility. So back to ALR. Sorry, I'm kind of jumping around a little bit here. But with that 90 days, once again, we understand things fall off the radar and corrections and stuff, but I just like to make it clear that we cannot issue a CSE, especially if we've been out there and done an inspection and the deficiencies are not corrected. So yeah, that process goes. Our inspectors will go in, do the life safety inspection, and then come up with a report and have an exit. Talk with your individuals, your leadership, and with your facility, and make sure that everything is clear and concise and how to move forward with that. And you should get that inspection report. Pete, am I missing anything?
Yeah, just the kind of when we come out and do an inspection, that's pretty much any facility that we go into. Our inspectors, we look at all the inspections are done out of NFPA 101 and the applicable codes from there. So when we come in, we're going to look, doesn't matter if it's a small residential boarding care facility or a big hospital, we're going to look to every door, every floor, everything in that facility. Once we go through, we're going to keep, our inspectors keep really good notes, and then we're going to let you know exactly what's the deficiencies that we find, and we try to work through those deficiencies with you to make sure that you know exactly where in the code it comes from and things like that. So we definitely do a lot of communication when we're doing our inspections and surveys, and so and it doesn't matter where it's at. The biggest thing for the difference between the nursing home, residential boarding care facility to a hospital, especially if we're there for a full survey on a hospital and it's a complaint survey. So because if that hospital is a deemed hospital, what happens is instead of just a normal K tag, usually if we find something pretty significant, you're going to get into a condition level tag. And once you get into that condition level tag, that's definitely requires a plan of correction. If I just write hospital up for a deficiency, say like a space heater in a space in an office or something that's not supposed to be there, it's not a condition level tag. It's not a serious issue. A hospital doesn't have to give us a plan of correction on that particular deficiency. It's only on condition level tags that a hospital has to give us that plan of correction on. So we try to handle it kind of at that level for hospitals. So that makes it a little bit different than some of the other facilities. And then, which I know we haven't gotten into, if you say a facility, a deemed hospital gets an immediate jeopardy, then that's a more serious issue. It's a life safety system that might not be operational or something like that. So during that time, with that, you have to make sure you go in and you at least temporarily fix it, do something to mitigate that immediate jeopardy. A hospital can lose their deemed status temporarily until that whole process gets taken care of and all that the deficiency gets taken care of. So it's a little bit more complicated on the hospital side, but it still works really well. We work with CDPHE really closely on that, and CMS when we have something like that. Even on the nursing home side, if we have to do an immediate jeopardy, we're working closely with CDPHE and CMS on those issues to try to get them mitigated and fixed.
Absolutely. And that's kind of the philosophy, right? We're all on the same team. We just wear different jerseys. Just to kind of back up a little bit, just to define, because we speak in a lot of acronyms for our listeners at home. POC refers to Plan of Correction. CMS is the federal oversight. It's Centers for Medicaid and Medicare Services. SNF, SNF is a skilled nursing facility. And ASC is an ambulatory surgical center. We just speak in a lot of acronyms, which kind of, layman's what we call it. But Chris, just to kind of wrap us up, and Brian and Pete touched on it both a little bit. Their different deficiencies have different sizes. Some are very important and very big, and some are small and still important, but a lot easier to correct. I can go into almost any building, any facility, any restaurant and find fire code violations, big or small. The philosophy that we really like to push here in this branch is education first, because compliance can kind of be a moving target, right? We adopt different code cycles. Just because you're in compliance today doesn't mean you're out of compliance. Not going to be out of compliance tomorrow. It's kind of a moving target. While we're there, that's kind of just a snapshot in time. But if we can go in and we can educate and we can get buy-in from our partners in these facilities, that's going to be commitment. So we always preach commitment over compliance. And that's why we try to work with these facilities the best we can moving forward on their plans of correction. And that's why we take our partnerships at the state and federal level so seriously. Because like I had said, we're all on the same team. We just wear different clothes. The ultimate goal is the safety of the citizens of Colorado, and that's everyone's focus. So, well, Chris, that's kind of our healthcare. That's a overview of kind of what we do. I turn it over to you.
Thank you, Jay, Pete, Brian. I appreciate you all for coming in today and speaking with us on Fire Talks. This has been very informative. I'm sure we could continue to talk for hours, but if our listeners want to learn more about this program or any of our programs here at the Division of Fire Prevention and Control, especially in the Fire and Life Safety section, you can go to dfpc.colorado.gov/FLS, and you'll be able to find out more about all of our programs. Just to remind you, Jay is the branch chief for fire prevention. Brian and Pete are both inspection unit chiefs. Pete is responsible for acute care, which also includes behavioral health entities. Brian is responsible for those residential facilities. If you have any questions, please reach out to any one of these three, and we'll be happy to help out. But again, thanks for joining us on Fire Talks. I appreciate you all, and have a wonderful day. Stay safe.